Welcome to the Cardiothoracic Surgical Site Care Guide. In this guide, you will find nursing practice standards for hand hygiene, aseptic dressing changes, sterile dressing changes, standard sternotomy site care, sternotomy Provina wound system care, chest tube insertion site care, Blake drain site care, mini thoracotomy site, pericardial window site, and robotic Lima cabbage site care, groin access site, great saphenous vein harvest site, and central venous catheter post-removal site care, pacemaker and AICD pocket site care, and radial artery harvest site care. The number one cause of surgical site infections, both nationwide and worldwide, is inadequate hand hygiene performed before and during surgical site care. Adequate hand hygiene must be performed by healthcare workers, the patient, and caregivers anytime they're taking care of the surgical site. Adequate hand hygiene consists of washing or alcohol sanitization of the hands. Hand hygiene must be performed before touching the patient, before clean aseptic procedures, after touching the patient, after body fluid exposure, and after touching anything in the patient's surroundings. During surgical site care, a minimum of 3 glove changes and 3 to 5 hand hygiene episodes should occur. Aseptic dressing changes require the use of a clean procedure field, clean gloves, and sterile supplies. During an aseptic dressing change, it is important to avoid direct contamination of supplies and the site. Gloves should be changed and hand hygiene should be performed prior to starting the dressing change, after removing the old dressing, and before cleansing and redressing the site. A sterile dressing change requires the use of sterile procedure field, clean and sterile gloves, and sterile supplies. During a sterile dressing change, it is important to avoid direct contamination of supplies and the site. Gloves should be changed and hand hygiene should be performed prior to starting the dressing change and between removing the old dressing and cleansing and redressing the site. After removing the old dressing, sterile gloves should be put on before cleansing and redressing the site. The sternotomy site dressing should be changed the day the pacer wires are removed, and then every 5 days or sooner if the dressing is not intact or it is leaking. The dressing is changed on the day of discharge if it has not been greater than 5 days post-op. If it has been greater than 5 days post-op and there is no open area or drainage from the wound can be left open to air. If the wound is not ready to be left open to air, the dressing should be changed the day of discharge, and then it can be removed by the patient in 5 days. The patient can shower with the dressing on. Showering is encouraged to be done daily with the dressing on, or if the wound is left open to air, with a liquid dial soap. Bar soap, scented soaps, and lotions should not be used on the site. The patient should also not submerge themselves in a hot tub, bathtub, pool, or other water, and swimming is prohibited until they are cleared to do so by their provider. Supplies for sternotomy site care include a mask and head cover for the patient and the nurse, non-sterile and sterile gloves, chlorhexidine swabs, silver alginate dressing strips, and a large tegaderm. The sternotomy site care process is a sterile dressing change process. First, sanitize your hands and put on a pair of clean gloves. Clean the care supply surface and prepare the area for your supplies and for the dressing change. Remove your gloves and sanitize your hands. Now, lay out the supplies on the clean surface and open the packages, being careful not to contaminate the contents. Once this is done, sanitize your hands and put on a fresh pair of gloves. Remove the old dressing and inspect the wound. Once again, you will remove your gloves and sanitize your hands. This time, put on the sterile gloves. Now you will clean the wound with the chlorhexidine swab stick, ensuring that you do not contaminate your sterile gloves in the process. Start centrally with the swab and move outward. Do not return to a cleansed area with the same swab stick. If re-cleaning due to blood or debris is necessary, use a new swab stick. Let the chlorhexidine completely dry. Now, place the alginate dressing on the sternotomy site, and then place a transparent adhesive dressing or your long tegaderm over the alginate dressing.
This is Katie. Hi, I'm Liz. We're going to be doing a sterile sternal dressing change. With the sterile dressing change, we want a sterile procedural field. We want clean and sterile gloves, sterile supplies, proper hand hygiene, and that's why we are also wearing the hairnet and the face mask.
Alright, so I'm just going to put on clean gloves and bleach wipe my field so I have a sterile field to work with. Let that dry.
Now Katie is going to change her gloves again and use proper hand hygiene once again so that she can lay out her supplies on the clean surface.
Yes, so we're doing a sternal dressing change, so my supplies include some sterile gloves. And I have a chlorhexidine wipe, silver tegaderm, and
So now Katie will put on new gloves.
alright, so I'm going to remove the old dressing.
Now Katie will remove the old dressing and inspect the wound on the patient. Katie will remove her gloves and sanitize her hands once again to be able to put on her sterile gloves. So we open up the packages prior to putting on the sterile gloves so that everything remains sterile within the packages. She's putting on her sterile gloves so that she can begin the dressing change. going to use the chlorhexidine swab to clean the wound, starting inward and moving outward. She will now place the alginate dressing down the sternal wound. And now placing the transparent adhesive dressing over the top. And that is our sterile sternal dressing change.
Press play, and Katie and Liz will walk you through the sterile sternotomy dressing change process. The Provina dressing is a sternal wound management system that is applied by the mid-level providers for wounds that have excessive drainage or infection. The Provina system is assessed by the nurse, and if there is found to be leakage or draining outside the dressing, the nurse's responsibility is to notify the mid-level provider. This dressing can be reinforced with tape around an area of leakage until the mid-level provider can come and address the situation. Care of mediastinal drain sites or Blake drain sites is done daily until the drains are removed. When the provider removes the Blake drains, the site is covered with mupirocin ointment and an occlusive dressing. The provider's dressing should stay in place for 48 hours. The patient can shower after the drains are removed. After discharge, dry, healing Blake drain sites can be left open to air and cleansed during showering with liquid dial soap on a daily basis. Mediastinal Blake drain site care requires a mask, gloves, chlorhexidine swabs, xeriform petroleum dressing, sterile gauze dressing, and silk tape. To perform mediastinal Blake drain site care, first sanitize your hands and put on your gloves. Clean a care supply surface to put all your supplies on. Remove your gloves and sanitize your hands. Lay out the supplies on the clean surface. Open the packages. Now sanitize your hands and put on a pair of gloves. Remove the old dressing, inspect the insertion site, and again, remove your gloves and sanitize your hands. Put on a pair of fresh gloves. Now clean the insertion sites with chlorhexidine swab stick. Clean around the base of the tubes and move outward. Do not return to a cleansed area with the same swab stick. If re-cleaning due to blood or debris, use a new swab stick. Let the chlorhexidine dry. Place xeriform petroleum gauze around the base of the tubes, and then place a dry sterile gauze over the xeriform and secure it all in place with tape. Chest tube insertion care schedule. The chest tube insertion site dressing should only be reinforced for the first 24 hours after insertion. If the chest tube insertion site dressing needs to be changed within the first 24 hours after insertion, the mid-level needs to be notified. If you're instructed to change the chest tube dressing, only the tape and the gauze are removed. Do not remove the xeriform. The chest tube dressing should be changed daily until the drains are removed. When the provider removes the chest tube, the site is covered with xeroform petroleum gauze, a dry sterile gauze, and a tegaderm. This dressing stays in place for 48 hours. The patient cannot shower for the first 48 hours. 48 hours after tube removal, the dressing can be changed to a dry sterile dressing. After discharge, if it is greater than 48 hours since chest tube removal, with a dry healing chest tube site, the site can be left open to air and cleansed during showering with liquid dial soap. Chest tube insertion site supplies: a mask, gloves, chlorhexidine swabs, xeroform petroleum dressing, sterile gauze, and silk tape. Chest tube insertion site care. First, sanitize your hands and put on your gloves. Then clean the care supply surface area. Remove your gloves and sanitize your hands. Lay out the supplies on the clean surface and open the packages, being careful not to contaminate the contents. Sanitize your hands and put on a pair of gloves. Remove the old dressing, inspect the insertion site. Now remove those gloves and sanitize your hands again. Put on a fresh pair of gloves. Clean the insertion site with a chlorhexidine swab stick. Clean around the base of the tube, moving outward. Do not return to a cleansed area with the same swab stick. If recleaning due to blood or debris, use a new swab stick. Let the chlorhexidine dry. Place xeroform petroleum gauze around the base of the tube. Then place a dry, sterile gauze over the xeroform and secure the tape.
This is Katie, I'm Liz, and we're going to show you how to do a chest tube dressing change. Katie will be sanitizing her hands, proper hand hygiene. She has all her supplies ready here. We have chlorhexidine, we have xeroform, we have split gauze, regular dry gauze, as well as tape. And then here we have our securement device to hold the chest tube. Now Katie will place her gloves. She will actually place 2 pairs of gloves on, as the xeroform which we use during the dressing change is very messy, and therefore you need to take off a layer of gloves. So first, Katie will begin with the chlorhexidine swab to clean the site around the tube, and also make sure you clean on the tube as well, for some of the tube is underneath the dressing. Now Katie will place the xeroform. However, for the purpose of this video, we will not actually be placing the xeroform on the mannequin. Given the nature of the xeroform, we'll substitute it with this other gauze. However, we usually use this yellow xeroform, as you can see here. And we take it and we wrap it around the chest tube site so that it completely circles around the tube at the insertion point. In which this gauze is extremely messy, so at this point Katie will remove her outer layer of gloves. And now she will place the split gauze so that it goes around the chest tube. Next, Katie will place the outer layer regular dry gauze on the top, and which she will apply tape. And then we can use our securement device to hold the tube in place to provide more comfort for the patient. And that's our chest tube dressing.
Katie and Liz will now demonstrate the care of a chest tube insertion site. Patient education for patients discharged with a chest tube in place. Patients discharged with a chest tube and pneumostat or a Heimlich valve need to be taught how to use the pneumostat or valve. Patients discharged with a chest tube cannot shower, take a bath, use a hot tub, swim, or otherwise submerge themselves in water until the chest tube has been removed and they are cleared for these activities by their provider. Patients discharged with a chest tube will have home health care nurse visits to perform site assessments and dressing changes. Patients discharged with a chest tube without home care nurse visits will need to be taught how to change the chest tube dressing daily. Patients discharged with a chest tube need to know how to reinforce the dressing and how to cover the site emergently if the chest tube gets dislodged. Mini thoracotomy sites, pericardial window sites, robotic Lima cabbage sites, groin access sites, great saphenous vein harvest sites, and central venous catheter post-removal sites all have very similar care, both inpatient and after discharge. For inpatient care, the dressing is removed post-op day 1. If steri strips are present, leave them on until they fall off by themselves. Cleanse the site daily with chlorhexidine soap and water or chlorhexidine wipes. Apply a dry sterile dressing if there is any drainage. When patients are discharged, the surgical site should be cleansed by showering daily done with dial soap. Leave the steri strips on until they fall off by themselves. Do not use bar soap, scented soaps, or lotions. And do not submerge surgical sites in a hot tub, bathtub, pool, or other water. No swimming until the patient is cleared by the provider to do so. Supplies necessary for the care of these sites include a mask, gloves, and chlorhexidine bath wipes or chlorhexidine soap and water.
I'm Liz, this is Katie, and we're going to demonstrate the care of what we call an OVH site. So with this, where they take the vein for the heart surgery, in surgery they'll place a dry gauze with tape over it. There are steri strips underneath the gauze as well, and this dressing can be removed one day after surgery, as Katie will demonstrate. And as you can see here, these are the steri strips. These do fall off on their own. We instruct the patient not to take them off. And part of the incision care is that the incision sites get cleaned daily. So if the patient's not showering, we'll use a chlorhexidine sponge to clean the site. If the patient is showering, they can use the chlorhexidine soap in the shower to wash the incision. And then we just leave it open to air from then.
Okay. Katie and Liz will now demonstrate open saphenous vein harvest site care. Pacemaker and AICD insertion site care. While the patient is inpatient, the pacemaker or AICD pocket site will have a dressing that stays on for 5 days post-op. The patient is not to shower for 5 days. If there is excessive bleeding or drainage, reinforce the dressing and notify the provider. After 5 days, the dressing is removed and there should be steri strips that will remain in place until they fall off by themselves. The site should be cleansed daily with chlorhexidine soap and water or chlorhexidine wipes. At discharge, if it has been greater than 5 days post-op with no open areas of drainage, the wound can be left open to air. Once the dressing is off, showering with liquid dial soap only should be done daily. The patient should be instructed to not use bar soap, scented soaps, or lotions. Do not submerge surgical sites in a hot tub, bathtub, pool, or other water. No swimming is allowed until the patient is cleared to do so by their provider. Radial artery harvest site care. Monitor the donor extremity for ulnar pulse, temperature, color, capillary refill, sensation, and movement of the fingers. Monitor pulse oximetry in the donor arm and compare to the collateral hands. Do not do manual or automatic blood pressures on the donor arm for the duration of the hospital stay. Do not place intravenous device in or draw blood from the donor arm. Do not apply tourniquet to the donor arm. Use a loose dressing on the donor site. Do not use a compression dressing. Keep dressing in place until post-op day 1. After post-op day 1, cleanse the site daily with chlorhexidine soap and water or chlorhexidine wipes. Patient discharge instructions for radial artery harvest site. The wound can be left open to air. Showering with liquid dial soap only should be done daily. The surgical site should be cleansed with soap once the dressing is off. The patient should not use bar soap, scented soaps, or lotions, and the patient should not submerge the surgical site in hot tub, bathtub, pool, or other water. No swimming is allowed until the patient is cleared by their provider to do so.
I'm Liz, this is Katie, and we're going to show you how to care for a radial artery harvest site. So with the radial artery harvest site, you'll see that the dressing will be applied in the OR, and it's just a dry gauze and a tegaderm over the top. Underneath you'll see that there are steri strips as well over the site. So 24 hours after surgery, you can take the dressing off, as Katie is doing. And then as you can see here, there's the steri strips. These do fall off on their own. We instruct the patient not to pull them off. So with this site, you want to make sure that it is getting cleaned daily. So if our patients aren't showering on their own, you want to make sure you're at least using the chlorhexidine on the site each day. If they are showering, we instruct them to use the chlorhexidine scrub in the shower each day on the incision site. Also with this arm, you would instruct no blood pressures on this arm, no blood draws, no IV insertions, and no tourniquets are to be placed on this arm, and very minimal use for the entire hospital stay.
Okay. Liz and Katie will now demonstrate the care of a radial artery harvest site. Patients receiving a left ventricular assist device go through extensive education and training with the advanced heart failure team prior to receiving their device, during their hospitalization, and again after discharge. The slides below are a brief overview of left ventricular assist device driveline site care. Please use these as a quick reminder, but if you have any questions, please contact one of the members of the Advanced Heart Failure team or review the left ventricular assist device driveline site care videos and education provided by the Advanced Heart Failure team.